Okay, first and foremost, a thank you. A thank you to all of you, to the teams that you support during sort of lockdown, the first lockdown, the second lockdown. I know that Joan Morn, our independent chair, and the board members wanted me to pass on my thanks to you all for all of the hard work you've done. You've gone over and above often what is asked of you. You've worked in very difficult circumstances, and it doesn't go unnoticed, certainly from the perspective of the Safeguarding Adults Board that we have for the county. So this is just by way of saying thank you and passing on thanks, as I said, from Joan, our chair. What I'd like to do today is two topics and then a few items of news to update you on, share with you. First one is around sort of professional curiosity, and particularly at this time as we've been working through unprecedented circumstances, you know, the COVID response, the pandemic and the lockdown, we have even greater requirement, opportunity, if you like, to be that little bit more professionally curious when we've got an issue of concern that's come to our attention, or it's come to a member of your team. I'm also then going to share some sort of headline updates on LPS, and as I say, then a few items of news to finish with. Running the session, yes, if you've got a burning question, please put your hand up and I'll do my best to answer it, or add a comment into the chat box, and we can hopefully pick that up at the end. So why professional curiosity, and why me, or why you, why your teams? Well, you have contact with a huge number of people, both who come into your service, whether you're a care home, domiciliary care provider, and you are connected to the community that you serve in many ways, and the role that you have is critical to safeguarding, because you might not have it in your title, but it's woven within the work that you do. It's everyone's business is, I'm sure, a phrase that you've heard before. The best results that we can achieve, though, to protecting those who experience abuse and harm in their lives is by working together, working across services, working as a sort of multidisciplinary safeguarding team, if I can put it like that. And also, I think it's really important that we acknowledge that you or members of your team may be the only professional that has contact with this person. So, and it also might be something that you pick up from a visitor to your home, for example, to the care home. Or somebody that's a relative of the service user you're supporting, and you may be the one person they actually have the strongest relationship, they feel safe with, to share something that's worrying them or concerning them, and so you may become aware of a situation which actually others don't know of. So there are a whole range of reasons why this is really important, in terms of the vital role that you can play in safeguarding. And what's it about? Well, again, this won't be anything new to you. It's about prevention of abuse and harm. It's about sort of that radar that you have for seeing something that isn't quite right, something is wrong, and then it's about sort of asking those next questions. And abuse can affect one person, many people. It may be a deliberate act, or it may be something that isn't necessarily deliberately intended, but there are harm or abuse is the outcome. It may be an isolated incident, as I'm sure you will know, or it may be a series of things that happen, a pattern. And over on the other side of the screen there, just by way of reminding us, we've got those 10 categories of abuse that need to be on our radar. So professional curiosity, what is it? Well, I suppose the sort of headline here is it's about having good radar. It's, if I can put it like that, it's about having, you know, sort of your eyes and ears sort of open in situations, when noticing when something isn't quite right. There is sometimes a phrase that we use within adult safeguarding that, you know, so sometimes people say, well, I just wasn't sure. I mean, my gut feeling was this. 9 times out of 10, you'll be right. 9 times out of 10, something won't be as it should be. And so we encourage all of our partners to sort of then go and sort of ask the next questions for detail, you know, but also, rather than just sort of ask questions and take things at face value, sort of seek some evidence that would support that. But running throughout a professional curiosity, a professional curious approach within adult safeguarding is the key role to keep, you know, positive, strong relationships, and they are really important to establish the trust that people will have in you, that they may share something that isn't quite right. As I said, you may be the only professional for whom they may share that. Considering mental capacity is woven throughout, again, our safeguarding work, and it is absolutely sort of important to that professionally curious inquiry that we need to identify issues of abuse and harm. And then about sharing your concerns, of course, getting that sense check. This has happened, didn't feel quite right to me. What's your take on this? This is what I've got some understanding of what's happened. Here is potentially some sort of evidence towards that. And then sort of making sure that you get those sort of other views, you know, sort of shared with you. That sense check, as I said. And why should we be curious? Well, here on the screen you'll see just a summary of a safeguarding adult review that the board ran, and we published it at the beginning of this year, which seems an awful long time ago now, which was about an issue within a care home where the heating failed, and in fact a number of residents became unwell. They became pre-hypothermic, but one in fact was so poorly that they needed to be admitted to hospital for further care, and very sadly they died. They died due to becoming hypothermic. And what we found from doing that review is we had a good number of professionals and others coming into the care home, but everybody presumed and assumed that the problem was either just the day that they visited, and that it wasn't necessarily that longer term problem that the care home was experiencing. And unfortunately, when we did some detailed work with colleagues, we started to understand and appreciate that actually many people thought someone else was addressing the concern, had raised it for something to be looked into. And unfortunately, you know, everyone else thought someone else was doing something. It has, you know, a greater impact on those who are frail, less mobile, and those residents that were dependent. And again, that wasn't necessarily recognised. People arrived into the care home, oh, this is cold in here. They put their coat on, and then they went about, you know, the reason for their visit. Perhaps overlooking that if you can't move about and you can't keep yourself warm, the impact that will have on you is much greater. None of the professionals asked for evidence that the home was taking steps to repair the boiler, which I think was of note and is important perhaps to touch on it as well. And none of them necessarily shared their concerns with their teams or other agencies. So again, a missed opportunity here for us to be professionally curious in terms of our safeguarding role. And you can access that report on the board website, and I would encourage you to do so, because there's some, as I say, really important learning for us there. So what can you do? What can you do to support your teams here? Well, I guess it's a number of things. It's about being flexible and open-minded, of course, not taking everything at face value, as I said. It's about creating a culture where that's encouraged. Being aware of your own thoughts about sort of risk and the environment and the relationships and how they might affect your view of a situation. So you might be feeling and thinking, well, this doesn't necessarily look particularly concerning to me, but actually it may well be concerning of a risk to others. It is a reminder for us to perhaps keep in the back of your mind, or tuck it in your back pocket, so to say, about thinking the unthinkable and believing the unbelievable, but sort of trying then to sense check that against any objective evidence that you may have. And when I say evidence, I'm not asking you to investigate. No, that's something that if there is a need for a full Section 42 inquiry, then there are people, as you know, that are trained to do that alongside you. It's important that we have good and clear and strong communication skills, that we've checked up those facts, as you can see there, and never assume, and be wary of the assumptions already made. And perhaps these are maybe assumptions that you've got, or maybe a team member has shared with you. So sort of check those out, sort of challenge those in a positive way to help you best understand the situation and the risks that there may be there in terms of abuse and harm. Quick update for you now on mental capacity during the pandemic. And this slide, what I've done is I put up the key document that we are still currently working to. I'm sure many of you on the call today have got a copy of that, maybe got it bookmarked on your computers as well. And that's the point where that's the sort of the web page which is regularly updated. This is still the live document that we need to work to during the pandemic response, and it was last updated in terms of guidance on mental capacity on the 11th of November, as you can see there on the slide. I've also just included, as I know that you will be aware of, those sort of updates to the national restrictions for visiting care homes in particular, specifically, and that was made on the 5th of November. In terms of key updates on the 11th of November, what I've done is put them onto the slide there. I'm not going to go into detail for these because you can, they'll be available to you afterwards. But that just summarises where those updates were, because there is a lot of information on the government webpage for mental capacity, and it can be a little difficult or tricky sometimes to sort of find the latest information that you need to have in front of you. So to help, I've just updated I've updated those there. So liberty protection safeguards. The big update that I think is sort of key to the meeting today is that the national working group that is carrying from the Department of Health and Social Care, that's carrying forward the work to move from the deprivation of liberty safeguards to the liberty protection safeguards, has recognised that the original ask of care home managers to hold responsibilities under LPS was particularly challenging, and I'm very pleased to say that that requirement will be removed, or has been removed, from the proposed plan to implement as of April 2022. So that's I think very positive. It's recognised that the role that care home managers were being asked to perform wasn't the best way forwards, and this has been recognised by the department, and so it will be removed from the proposed framework. However, April 2022 feels like a long way away, but actually there is an awful lot to do before then. And on the right side of the screen, I've just summarised the sort of key points that we've got from where we are now through to LPS going live. And what we'll have next year is a 21-week public consultation period, so keep your eyes open for that and feed into that, please. Then following that consultation, the government will create and update the new code and the regulations, and they'll go to Parliament. And then once they pass through the parliamentary process, then there'll be another 6 months before that date of April 2022 when they go live. So as you can see, there is a huge amount to be done from where we are today to get us to that go live date in April. But the headline news is that that requirement on care home managers within the LPS proposals has been stepped down, has been withdrawn, and I think that's a good. I think that's a very positive and valuable move. So between now and then, there are some absolute must-dos that I would perhaps remind colleagues of, and that is good MCA DOLS practice that you'll be doing anyway, but this is just to perhaps reinforce that message and to remind us of that. And that's before you have admission to your care homes, the care home in particular, care home service, is to check that the person has capacity and evidence of that. And if they don't have capacity for moving into the care home, then to ensure that that Mental Capacity Act assessment has been completed. And if it demonstrates they lack capacity for that move, then we've had best interest meetings. And that you've asked, I would positively encourage you to ask those questions to receive a copy. Now, if you're told that that's not possible to share with that, I would advise that you're requesting the placing social worker or nurse confirms to you that that is the case, and then that can be recorded in the care record. We've had a couple of incidents, I understand, where care homes have not been able or had not had those capacity assessments shared with them. If that does happen, follow that advice there at the bottom of the slide. Quick updates to finish then for you. I just wanted to touch on COVID-19 and adult safeguarding. The response document that we've created to support us as a county, and then White Ribbon Day that we've got tomorrow, in fact. So on safeguarding adults and COVID-19, the SCI has recently published a series of really helpful resources about at the beginning of this month, I believe, and they include summary information on safeguarding adults within the COVID pandemic response and the current lockdown that we are working through. Things like helpful strangers, types of abuse, reductions in normal working services, and so on. So there's a really good place to go for very clear summary information on safeguarding that we've got nationally. Locally, the Safeguarding Adult Board has developed a responding and reset plan, and this will be published all being well when lockdown 2 finishes. What we've done is, working with our partners and the network, we've identified 3 key areas, as you can see there on the screen, where we need to focus. We'll be focusing attention on in terms of safeguarding activity: access to day services, the experience of carers, and particularly with increased pressure and worry, and volunteering and safeguarding. Alongside those, we will be supporting other partners who hold responsibility for other areas of work, particularly around the care home provider sector, domestic abuse, and we've been working hard to raise the issue as it impacts on older adults and the discharge to assess process. So we will be tracking and supporting partners' work on those issues as well, but those key areas that we've identified are the 3 just mentioned. And then to finish, we have the White Ribbon Day, which is tomorrow. And this year, Norfolk is focused on encouraging employers to sign up to the HERE pledge, which you can see there on the screen. So what I'd like you to do, please, is take this information back to your employers, and ask them to go and sign up to the HERE pledge to call out domestic abuse as part of this year's campaign, and the website links are there. And then finally, to finish, some take-home actions for you. Please bookmark the government LPS document collection page. As I say, that's the page where they update all of the information on LPS and mental capacity.